Welcome to our channel. In this episode, we will be examining the gastrointestinal tract, also known as the GI tract. We are going to be looking at all the various aspects of the GI tract, the symptoms, the remedy, and the cure, when possible. This is going to be a lengthy video, so we may have to break it into parts. Please stay tuned to the end to get the complete picture. Thank you. GI upset is a broad term used to describe discomfort or irritation in the gastrointestinal tract, which includes the stomach and intestines. It is not a single disease, but a group of symptoms that can happen for many different reasons. People often use it to describe nausea, bloating, stomach pain, cramping, gas, diarrhea, or sometimes vomiting. The digestive system is responsible for breaking down food, absorbing nutrients, and moving waste out of the body. When something disrupts that process, GI upset can happen. Common triggers include eating something spoiled or hard to digest, food intolerances, infections, stress, certain medications, and underlying conditions like acid reflux, gastritis, irritable bowel syndrome, or a stomach virus. Symptoms can range from mild and short-lived to severe and persistent. A person might feel queasy after a heavy meal, have loose stools after a bad reaction to food, or experience cramping and bloating during a digestive flare-up. In many cases, GI upset improves on its own with rest, hydration, and bland foods. But if symptoms are intense, keep coming back, or last more than a few days, it may point to something that needs medical attention. It's also important to pay attention to warning signs. Blood in the stool or vomit, severe pain, fever, dehydration, unexplained weight loss, or trouble keeping fluids down are all reasons to seek medical care. Babies, older adults, and people with weak immune systems can become dehydrated more quickly, so GI symptoms in those groups should be taken seriously. In simple terms, GI upset means your digestive system is irritated or not working normally. Because it can have many causes, the treatment depends on what is behind it. Understanding the symptoms and possible triggers is the first step toward finding relief and knowing when to get help. Gluten-free food can be good for the GI tract, but only in the right situation. For people with celiac disease, gluten sensitivity, or a wheat allergy, avoiding gluten can reduce inflammation, ease symptoms such as bloating, diarrhea, and stomach pain, and help the gut heal. In those cases, gluten-free is not just helpful, it is necessary. But for everyone else, gluten-free does not automatically mean healthier for the digestive system. In fact, many gluten-free packaged foods are more processed, lower in fiber, and higher in sugar or fat than their regular versions. That matters because your gut likes fiber. Fiber feeds beneficial bacteria, supports regular bowel movements, and helps maintain a healthy gut lining. If someone cuts out gluten but replaces whole grains with refined gluten-free products, their GI health may actually get worse. The biggest issue is that people often remove gluten without improving the overall quality of their diet. Whole wheat, barley, and rye can be good sources of fiber, B vitamins, and minerals. If those foods are removed, they need to be replaced with nutritious options such as gluten-free oats, quinoa, brown rice, beans, lentils, fruits, vegetables, nuts, and seeds. Those foods are much more supportive of gut health than a gluten-free cookie or a white bread substitute. So, is gluten-free food good for the GI tract? It depends. If gluten is causing symptoms, then yes, avoiding it can be very beneficial. If there is no medical reason to avoid gluten, a gluten-free diet is not necessarily better for digestion and may even be less gut-friendly if it lacks fiber and variety. The best approach is not just gluten-free, but gut-friendly. Focus on whole foods, enough fiber, hydration, and a balanced diet. If you have ongoing GI symptoms, it is best to talk with a doctor or dietitian before making major changes. Can eating healthy help your GI tract? Absolutely, and in a big way. Your gastrointestinal tract is responsible for breaking down food, absorbing nutrients, and helping remove waste. When it's working well, you feel it in your energy, digestion, mood, and even your immune system. A healthy diet supports the GI tract by giving it the tools it needs to function smoothly. Fiber is one of the biggest helpers. Fruits, vegetables, beans, lentils, nuts, seeds, and whole grains add bulk to stool and help keep things moving, which can reduce constipation. Fiber also feeds the beneficial bacteria in your gut, and those bacteria play a major role in digestion and overall gut health. Hydration matters too. Water helps fiber do its job and keeps digestion from slowing down. If you eat more fiber but don't drink enough, you may actually feel more bloated or uncomfortable. So healthy eating isn't just about what you eat, it's also about drinking enough fluids throughout the day. Another benefit of healthy eating is reducing irritation. Highly processed foods, excess sugar, and too much saturated fat can sometimes make digestive symptoms worse for some people. In contrast, balanced meals with lean proteins, healthy fats, and whole foods are often easier on the digestive system and can help support more regular bowel habits. Fermented foods may also help. Yogurt, kefir, sauerkraut, kimchi, and other probiotic-rich foods can support the balance of bacteria in the gut. For some people, this may improve digestion and reduce certain symptoms like gas or bloating. Of course, everyone is different, and some foods that help one person may bother another. Healthy eating can't solve every GI problem, especially if there's an underlying condition like reflux, IBS, celiac disease, or inflammatory bowel disease. But as a foundation, it can make a real difference. The gut responds to consistency, variety, and nutrient-rich foods. So yes, eating healthy can definitely help your GI tract. It supports digestion, nourishes gut bacteria, and may reduce discomfort over time. If you're having ongoing digestive issues, it's always a good idea to talk with a healthcare professional to find out what's really going on. Constipation is one of those problems that can make you feel uncomfortable, heavy, and out of sync with your body. The good news is that in many cases, it can be improved with simple changes in daily habits and food choices. First, let's talk about what constipation usually means. If you're having fewer bowel movements than usual, passing hard stools, or feeling like you still have to go after using the bathroom, your digestive system may be moving too slowly. Dehydration, low fiber intake, too little movement, stress, and ignoring the urge to go can all make it worse. One of the most important steps is to drink enough water. Fiber works best when it has fluid to soften stool and help it move through the intestines. If you suddenly increase fiber without enough water, constipation can actually get worse. So aim to sip water throughout the day. Next, gradually add more fiber-rich foods. Fruits like pears, apples with the skin, oranges, berries, and prunes are excellent choices. Prunes are especially well known for helping bowel movements because they contain fiber and natural compounds that support digestion. Vegetables such as broccoli, carrots, spinach, sweet potatoes, and green peas can also help. Whole grains like oats, brown rice, whole wheat bread, and bran are better options than refined grains. Beans, lentils, and chickpeas are also powerful because they combine fiber with nutrients that support gut health. Healthy fats can help too. Foods like avocados, nuts, seeds, and olive oil may support smoother digestion. Some people also find that yogurt with live cultures or other probiotic foods helps keep the gut balanced. Movement matters as well. Even a daily walk can stimulate the intestines and help food move through the digestive tract. Try to establish a routine, especially after meals, because the body often responds naturally then. It also helps to listen to your body. Don't delay going to the bathroom when you feel the urge. Establishing a regular time each day, such as after breakfast, can help your body become more consistent. If constipation is frequent, severe, or comes with pain, blood in the stool, unexplained weight loss, or sudden changes in bowel habits, it's important to speak with a healthcare professional. For many people, the right mix of water, fiber, movement, and routine can make a big difference. This is where we will be ending today's video. Please stay tuned for part 2 of this video. Thanks for watching. Please like, share, and subscribe.